Hello and welcome to today's episode in my Healthy Hormone series. My name's Sally Varley and I specialise in helping women to balance their hormones so that they can be beautifully fertile and have a really good menopause. And today I'm talking to Danielle Bodycote, who is a health researcher, and she actually doesn't live too far away from me in North Leicestershire, and she did a PhD about 10 years ago into the links between breast cancer and menopause. So we're going to be talking all about that today and hearing what she discovered. So welcome, Danielle. Lovely to see you.
And you. Thank you for having me.
You're welcome. So we were just chatting about the fact that probably lots of the viewers won't maybe know what a health researcher is. So could you just start by explaining a bit about your work and for anyone that's interested to know more about that?
Yeah, sure. So health research at a very basic level is that we want to find out what makes people ill or what affects their health, but also what we can do to make people better. So whether that's things they can do themselves or if it's certain types of drugs and medication and so on.
Yeah, and you were saying that you mostly work with other businesses, but that you're sort of also there for other health professionals who are quite interested in doing their own research, and you would partner with them to help them do that.
That's right. So a lot of health professionals will be quite active in reading other people's research that they've done. So they'll be used to going out and collecting those papers. But what they might not know is that they can actually produce that research themselves. And often they'll have a lot of questions and a lot of things that they're interested in that would help them in their clinical practice.
Right.
But the research doesn't exist already. So they can actually go out and produce that research and get those answers for themselves.
And are those kind of projects, for want of a better word, do they take a long time? What's the shortest that they could be, or the longest?
So I think if COVID's taught us anything, it's that you can actually turn research around very quickly when you want to. But the other projects can take, sometimes it's, say you're doing a clinical trial, sometimes these can be 5-10 years long.
Yeah.
And so it can be a really big investment of time. But you're probably not going to start at that level. So the level you start with, usually I'd say you can turn something decent around in a month or two.
That's really interesting. I'm sure there might be some health professionals watching who have often thought, I wish I could know more about a certain subject, and especially when you start to niche like I have into the world of hormones and fertility and menopause, then there's lots of questions that arise all the time, and like you said, the statistics and evidence and stuff is not always out there to know what the answers are. So
and I think sometimes the evidence isn't there, or there's lots of conflicting information, so people don't know which to listen to. So we can also do work around that to get an ultimate answer to a question.
Yeah, well, that's good to know, because that's definitely something I relate to. And I think as a health practitioner myself, I live and breathe this stuff, and I still find sometimes, I've just read that and it said that, and now something different is in the paper or wherever. So it is a bit frustrating sometimes, isn't it?
Yeah. I call it the Daily Mail syndrome, that one day coffee is good for you and it's bad for you the next day. So that's partly what I do, try and untangle some of that.
That's perfect. So tell us a bit more about your PhD then. What led you into that particular subject?
So my PhD was mainly focusing on breast cancer, and I always really wanted to work in cancer. Like, I think pretty much everybody, I've been affected by it. I'd lost a close friend, I'd lost my auntie to breast cancer, and so I wanted to research that and find out what we could do to stop that happening to other women. And so my actual PhD was around what causes breast cancer. And there's quite a lot of things that we already know about in a lot of detail. So breast cancer is a very hormonal disease, and that's why more women get it than men. And so a lot of hormonal factors can affect breast cancer. So things like when your periods first start, as well as when they end. So your age at menopause has an effect on breast cancer.
Mm-hmm.
So I came to menopause in quite a roundabout way, because once I started to look at it because of breast cancer originally, and then just got really interested in it as a topic, because it always fascinates me how little we actually know about our bodies and how they work. And there's still some really, really big gaps about, well, pregnancy as well, but around things like menopause that affect people on a daily basis.
Yeah.
And we still don't really know what drives them.
Mm-hmm. And it's actually, I mean, I joke quite often with my clients and stuff that my strap line should be, it's not normal and you don't have to suffer, kind of, because there's so many things to do with our hormones that, like you said, affect us on a daily basis. And so many women just put up with them because they don't know any different and they think it's normal, or we've been taught it's normal, or we might have even read that it's normal, and it isn't. And that, you know, our bodies should just function in a balanced, harmonious way, and we shouldn't, our period should just come and go. It shouldn't make us take time off work or stop us doing activities with our family or our, you know, going to exercise or whatever. And I just I find it quite hard. I'm just, you know, on this mission to tell women that they don't have to suffer, and that and it's all about providing information, isn't it, that's sort of valid and has been researched. So just before we get to the kind of menopause bit, you said that some of the things you looked at were things like the age of starting your period. So what came up when you looked into that?
So in terms of the age when you start your periods, if you start your periods younger, then that has you're more likely to get breast cancer. Right. And one of the reasons that is likely is because you have higher circulating levels of hormones. So when you're going through your period, your levels of estrogen and other hormones are quite high. Mm-hmm. So if you have your periods earlier, you tend to have more period cycles over your life, so then your hormones tend to be higher. It's probably worth saying, though, that when we're talking about things like risk of breast cancer or risk of any condition, it doesn't mean you will get it.
Yeah.
It's just saying that if you have two people who are very similar in lots of ways, and one of them started their periods earlier than the other, then that one's more likely to get breast cancer. But it's not that they ultimately definitely will, but it just helps us to understand a bit more about how these diseases work. And then if we understand how they work, then we can start to A, stop them from happening in the first place, and then B, develop treatments that can treat them when they do happen.
Mm-hmm. I used to have a teacher at acupuncture college who was an oncologist, and he used to say, this is slightly controversial, but he used to say, you know, all these kind of not anti-cancer, but stop cancer, let's cure cancer charities and stuff. He said it's completely pointless. We've all got cancer cells in our body, and it's just whether they get switched on or not. So he used to say dinosaurs had cancer, you know, we all could have cancer. And I guess when you're saying about, you know, the age someone starts their periods, well, it might be because a girl is overweight for her age, and that you know, because I know I think it said that when you wouldn't have periods before you're 7 stone, you know, that usually sort of triggers puberty, and that's when you might get to be that heavy. So but these days, because there's obesity on the rise in young people particularly, then they're heavier, and much more girls are starting at the age of sort of 10 or 11, whereas I think in my day, I'm now nearly 46, so I started when I was 13, and I think that was much more common. I don't remember knowing anybody, I don't think, that had started already. And
no, you're completely right. So one of the biggest factors that does affect the age when you start is weight. Like you said, there has to be a certain weight level that you hit, because it's the fat cells themselves that generate the estrogen and trigger that hormone response that starts your periods off. And one of the things I've actually, a different paper that I published was around looking at the trend in time when the age of period starts on average. Mm-hmm. And you're right, it's down, I think it's running at about 10 on average.
Right.
which is really low. I mean, when I was at primary school, like you said, it just wasn't, I mean, it wasn't on the curriculum, I don't think, or I think it was a giggly year 6 one-off session, because people just weren't really starting at that point. Whereas now it's definitely shifted into primary school age.
And that's quite sad, really, because they say that, you know, in the course of your reproductive years, we will have 400 to 500 periods. And, you know, especially if they are problematic, and those are the things that I work on, obviously, but, you know, if that's a lot of times to go through a monthly cycle, and especially at such a young age when you just don't probably even really understand anything about your body yet and what's happening. So I suppose that's a message really to parents, isn't it, of young girls, that is an important reason to keep on top of their weight and not let them become overweight at a young age.
And it obviously links very closely with exercise as well. It's quite hard to separate those two effects because of exercise being so closely related to weight. But there are things that we can do to try and have a look at them separately. And it looks like, even again, if you have two girls with similar weight, the one who exercises more will tend to have their periods later than the one that doesn't exercise.
Yeah, that's interesting. So, and maybe again, because the exerciser might be leaner and not have as many fat cells with the estrogen in them, would that be the thinking?
Yes, one of the things they're really unsure about, and it's difficult to tell, is whether it's the exercise that makes periods start later, or if the girls whose periods haven't started yet are more likely to stay in exercise. So maybe because they've not got to think about their periods every month, that actually they're more likely to go out and be part of those sports clubs and keep going, especially when you start to get into the more competitive sports. So just things like period pains and the practicalities around it can really put girls off.
Yeah, that's a good point. So, and one of the other things you mentioned was the age of Fellage, which is when our breasts develop.
Yes.
And how does that connect to?
So actually, the piece of research that I did was the first piece of research that had really looked at that in a lot of detail, which in terms of age of breast development and how that links to breast cancer. But to me, it just seemed a really obvious possible link, because we're talking about periods and hormones circulating. But breast development obviously relates to hormones circulating as well. But also, just at a very sort of crude level, you almost have to have that breast tissue there for that risk of breast cancer to happen.
Yeah.
And that's what cancer is. It's when your cells multiply too much, and a tumour can develop. So it's not necessarily, surprisingly, there's not a link particularly between breast size or breast density in terms of breast cancer. But I just wondered if there was something around the age when they develop, and it looks like there is, and potentially even stronger than the age when periods first start. So again, earlier breast development with a higher breast cancer risk. But there needs to be a lot more work done on that. It's hard to measure, because we tend to do studies where we'll look back and we'll ask people sort of our age and say, when did your breast develop? And it's quite hard, whereas your first period's a definite event, so you can remember it, and it's a big event, and so it's a big thing in your life. The breast development sort of happens over time, and there's no, today I've got breast and yesterday.
Yeah, true.
So it's quite hard to say, I got breast at that age. So it's harder for us to look at. So we need to really do studies where there's really long-term follow-up, right from when we've got children, and they can report it as it's happening, and then take that through into as they grow older, right up until breast cancer tends to be a cancer of older age. So we're talking following them up for 50 odd years. Yeah. And studies like that are already happening. So like there's a big one in Bristol that's followed a big group of children who were born in the 90s, so they're not actually children anymore, they're 30 odd now. And so we'll eventually, I mean, that study has already done loads of great research, but eventually we'll have a cohort of women that will be able to follow them all the way through early life, puberty, all the way through their sort of reproductive years, through to menopause, and see what's really happened.
Yeah, they're pretty powerful, those studies, because I remember reading somewhere recently about, I can't remember what it's called, but it's basically, like, you'll probably know, it's a national database, and it was how they discovered in the beginning that smoking caused problems, fetal problems, you know, and low birth weight and stuff like that. And prior to that time, people have been quite blasé about smoking, and they were like, yeah, it's fine, don't worry about it, your doctor probably does it too, you know. And it was only through tracking people over decades that they suddenly saw this pattern emerging among the children of smokers, and were able to say, actually, it's really bad for you. So I think that's interesting. But obviously,
I know which one it is. There's about 5 of them. They're national birth cohorts, and sort of every 10-15 years, they'll randomly select a load of the pregnant women across the country and try and recruit them into the study to get an understanding of what's happening nationally with people. They're great. I mean, you find out such useful things from them.
So tell us more about your PhD, and how did you end up sort of at the menopause end of this hormonal picture?
So I did end up at the menopause end, but also, like I said, at the beginning as well. So it's kind of the two ends that I was interested in. So I just find menopause really interesting in that we still don't really even know why we have it. And there's lots of theories out there about why menopause happens. So there's things like the grandmother theory, that it's because actually you don't want grandmothers to be having their own babies, because when we were sort of back in caveman times, that then the grandma could all help with raising the babies and protecting sort of the next generation. And there's loads of like different theories about why menopause happens, but really nobody fully knows. So that was what first captured my interest. But also just because of the links it has with so many other things. So we spoke about breast cancer. There's lots of other diseases, so ovarian cancer and so on, and things to do with like bone health. But fertility was a big one for me, because I just remember seeing this chart of how your fertility goes over time, and then it sort of how it's not actually menopause that ends fertility necessarily. It ends potentially sort of a few years before that, although a lot of people have a spike. You probably knows better than I do, but a lot of people tend to have a spike kind of quite close to menopause and how fertile they are. But I was just sort of thought, well, what if you don't know? What if you're going to have an early menopause and actually your fertility window is quite small, but you're not aware of that, and you could potentially even do things to change it. But again, if you don't know that information, it just felt like a really important part about ourselves that not many women really either think about or talk about.
I think so there's a few interesting points there. I think it's generally understood that our fertility kind of drops off a bit of a cliff after the age of 35, and it's also because probably lots of the viewers will know that we're born with all the eggs that we're ever going to have, but it's not to say that you can't make those eggs healthier. It's like the potential of an egg, it doesn't just mean like, well, you just get what you're given and that's all you have to accept it. You can't do anything to improve it. The other thing is that sometimes as women reach menopause, they occasionally release 2 eggs a month. So they could be fertile, when they're not expecting to be. And of course, if you're perimenopausal, one of the first symptoms is that your cycle might become irregular. So you may be having irregular bleeds, and then you feel like you're coming to the end of this fertile time, but actually you could have ovulated at a time when you really weren't expecting it, and that's why sometimes people end up with a little menopause surprise.
And that's quite often it's non-identical twins as well, isn't it? Because there's two eggs at once ovulated.
And I mean, it happened actually to a family friend of ours that had already 4 children, and then she got pregnant at 47, and she just said, I thought I was done, and went on to have the baby, but it was quite a big, I mean, that was about 20 years ago, so that was sort of quite a big thing at the time, because obviously these days there's a lot more women having babies in their 40s than there are at 20. And the other thing is, I do encourage my clients to ask their mums, if they can, what age they went through menopause, and what their pregnancies were like, and what their own hormone story was, because typically if there's a problem, you might get the client going, oh, we've all got bad periods in our family, or we've all got endometriosis or something, but if they don't know about an issue, or they maybe, like, their mum might have had a hysterectomy at a young age, and so she didn't really talk about what that was like, and being thrown into menopause because of that. So it is interesting to get that info if people can. And
I'm so glad you said that, because that was going to be one of the things that I was going to say. Make sure, if you can ask your mum, or if you can't ask your mum, sort of anybody else in your family, because it has such a potentially big impact on your own age at menopause.
Yeah, I mean, I've heard conflicting stuff about that it doesn't run in families, so it's not necessarily the case that if your mum did, that you will too. But do you feel that, or your research?
No, so most of the research points to it does run in families,
right?
So it tends to be for approximately every year later that your mum has menopause, you will have menopause about 2 months later on average. So it doesn't mean that you will necessarily have menopause at the exact same age as your mum. It's just that you have a tendency to either have an early or late one if your mother does. And then if you have an early menopause, so I'm talking between the ages of 40 to 45, so not under 40, which is premature ovarian failure, and I didn't look at that. Then, so if your mum has an early menopause, you're 6 times more likely to have an early menopause.
Right.
And the same if your mum has a late menopause, so from about age 55 onwards, you're 6 times more likely to have a late menopause.
Right.
So it's really worth knowing.
Yeah. So just to clarify to the viewers, the average age in the UK of menopause, which actually refers to the day when it is 1 whole year since your last menstrual bleed, that is the menopause, and that age is 51 in the UK. So everything before that is perimenopause, and like you said, it normally starts around 45, when your cycle might start to go a little bit haywire. If you are having irregular bleeding or hot flushes or night sweats or any of the other things prior to 45, then that is considered early menopause. And then you just mentioned something called premature ovarian failure or insufficiency, which is when you basically don't have enough eggs, or enough healthy eggs, and that happens under the age of 40, and they can determine that by testing your hormone levels. But today we're just talking about early menopause. That's a kind of completely separate thing.
It's such a separate topic, and I just think it's worth sort of mentioning it's separate. But like you said, I think it's just so important to know about your own family history in this. Like, I've got a friend who recently was dismissed quite a bit by her GP going with various symptoms, and then when she asked her mum, she found out that she'd been through menopause before the age of 40.
Right.
So all of a sudden her symptoms actually look a lot more, not serious, but a lot more convincing. than they did before she had that information.
Mm-hmm.
So it can really help, I think.
Yeah. And so what other things should a woman look out for, and what can we do about them?
So interesting, we spoke quite a bit about weight and exercise when I was talking about age at first period. It's not so clear when you look at menopause, which just again from a general health research point of view is quite interesting, because I feel like a lot of the things that I research, I spend the whole time saying it's about your weight, but actually it might not necessarily be the case with menopause. There's a possibility that women who are overweight or obese do have a later menopause, but at the moment it's really not clear, and if that relationship is there, it isn't particularly strong. Similar for exercise, so women who exercise quite a lot may have a later menopause as well, but again that relationship, we're still trying to untangle that really from the research.
So that's quite interesting, because we're saying that in the beginning being overweight could cause your periods to start earlier, but then it may at the other end cause your menopause to be later. So it's
yes, so there's no clear exactly. So there's no clear idea sort of why that is, but I think it's because there's not such a direct link. So you spoke about women being born with a certain amount of eggs, and in effect menopause happens when those eggs or the number of eggs has got too low to maintain periods. So menopause can basically be pretty much affected by two things, and it's how many eggs you have to start with, which is predetermined, and how quickly those eggs are lost throughout your lifetime. So one of the sort of theories around exercise and so on is people, if you look at kind of high performing athletes, often they don't even have periods, or they might have very irregular periods, so they may not be losing as many eggs as quickly as we think that, or if they would if they weren't doing that exercise. So some of the kind of ideas around weight and exercise affecting menopause or not affecting menopause is just that actually the impact they're going to have over your lifetime on your cycle length and how quickly you lose that eggs, it's probably going to be quite small, because we're not all high performing athletes. So if I go out and do I'm not anyway, so if I go out so if I go out and do a run every few days for a week, is that going to affect my cycle length? Probably not. Whereas if you're looking at the younger girls, the amount of exercise they're doing, and you do tend to have some that do a lot of exercise for their age compared to others, and you have those extremes, you can see how it might start having more than a bit more of a pull on when first period happens.
And so are you saying that breast cancer is more common in menopausal women, or does it affect all age groups equally?
It affects all age groups. There's actually a really important distinction as to if breast cancer happens before or after menopause, and it's one of the most important factors we have actually in distinguishing breast cancer. So they actually tend to call it premenopausal breast cancer or postmenopausal breast cancer, and they tend to be treated differently. If you have two women who are the same age and are pretty much the same for lots of other things, the one who is still having periods will tend to have a higher risk of breast cancer than the one who isn't. So early breast cancer, although it's not great in terms of fertility, is actually protective for breast cancer. Again, it's because when your periods stop, your hormone levels come down so much, and those low hormone levels are good for breast cancer.
And what's your view, you don't have to answer this, but again I think it's a bit controversial, but what's your view about people having mastectomies if they've got the BRCA gene?
So the BRCA gene has such a strong impact on breast cancer risk. I can't remember the numbers off the top of my head, but there's different types of BRCA genes, and certain ones have got, you're not guaranteed to get breast cancer, but you do have an incredibly increased risk. So again, it's a personal decision, but I can understand why people do that. And quite often you'll find that those women also have, I can never say it, oophorectomy, where you have your ovaries removed. Again, that's because that drops your risk down so low, and it's because you surgically bringing on menopause. So you're giving yourself that early menopause and reducing your risk in that way. So a lot do have hysterectomies as well.
Right, because I know that sometimes, you know, you read stuff that says that you know, there isn't any point having your breast removed, but actually if you've got the BRCA gene, but then, like you were saying earlier, that there is a link between actually having breast tissue and there for the cancer to grow in. So if it isn't there, then that sort of makes sense, doesn't it? That removing it would lower the potential.
Yeah, I mean, it's worth saying as well, BRCA gene relates to other cancers as well. So particularly ovarian cancer. So I feel slightly old now, but originally when you used to go and get your genes tested, you would go through genetic counselling, and you would have to speak to somebody about really understanding, actually, okay, so if I do find that I have this gene, what does that mean? Making sure you really understand what risk is, and that it's not that you will be guaranteed to get something, but how likely it is, and so on, and talking through, okay, so how would you feel if you got that, and so on, and all the possibilities. You would then do the test, get your results, and then you would have more genetic counselling to interpret those results. And it was quite a guided process, whereas now obviously it's a lot easier. I mean, you can order a gene testing kit online, and you don't have that support network. So I would always say to somebody, if it's okay if you want to find out a little bit about your ancestry because you're doing your family tree, but if you're doing something that's going to have serious medical consequences, there's a real need, I think, to make sure you go through genetic counselling as well.
Yeah, because that is, I mean, obviously, like you said, if you get it younger, then it could impact on your fertility, which is a huge thing for loads of women if you want to have a family. And but I mean, it still would be a big thing. Even, I mean, I think even women just going through ordinary menopause without any problems to speak of still feel a sense of loss and sadness, and there's an emotional processing to be done, isn't there?
Exactly.
Even if you've had your kids, you don't want any more, so what, you still feel like, oh, this part of my life's coming to an end. And if that suddenly, you know, really got brought forward because you discovered that you had to make some decisions about your, you know, maybe having surgery, or that might mean that you'd be unlikely to conceive or whatever, then I definitely think people should have some kind of counselling and support in place for that. So it's almost wrong that they would let people do gene testing just online, and do you know what I mean?
Yeah, definitely. And I think, like I said, there's so many things you can't do around menopause and infertility, and because you were saying the number of eggs is determined already, and these things happen within our genes and going back centuries. But actually, there's still things that we can do. And I mean, you spoke about improving the quality of your eggs, but there's things around diet, and there's things around smoking. So, like, I mean, it's an obvious one, but don't smoke. Helps. So I feel like, to me, it's important to know about your family history, because I think knowledge is power, and knowing what might be in front of you, or what's sort of possible to be in front of you, can really help you. But then I think there's also things that you can do, and there's things you can control. So having those two pieces of information can really help.
Yeah, and also, you know, say somebody's watching and her mother's no longer with us, or she's adopted, and doesn't have any info about her sort of birth history, I mean, for somebody whose mother has died, could she ask her aunts? Would their experience be relevant, or is it not connected?
Yeah, no, so it is relevant. And so we talk about first degree family members. So they're ones that are sort of your immediate family. So your mum, your sister, and so on. And then you have your second degree ones, which is sort of the next step removed. So that would be your aunties and your grandparents. Mm-hmm. And actually, their menopause age, again, relates to yours because these things run in families. So it won't be as closely tied to yours as your mum's would. But it's still really useful information to have. And actually, even people that are able to ask their mum, I would still be asking aunts, grandmas, or whoever you can, because there's always odd ones out. And so the more you can build up that picture and that pattern, the more helpful it is. Sisters are another one. If you've got an older sister, that's a great one to ask. And we know that early and late menopause does, but that could be because you share genes with your family members, or it could be because you have very shared experiences with your family members. So you tend to have a similar diet, you potentially have the same exercise habits, you're more like to smoke if people in your family do, and so on.
Yeah.
So one of the things I did was try to untangle how much of that kind of shared experience plays a role, or is it shared genetics? And actually it looks like it's both. So there's a lot more work that needs to be done still to work out quite what's going on, but it just shows that it's not all predetermined. So some of that relationship within families and why it does run in families is because of what we're doing. And so again, you can change that, which I think is always quite nice to hear. I like to have control, so for me it's good.
Well, absolutely. I mean, I think we'd all feel quite depressed, wouldn't we, if we were born into a family where cancer was quite prevalent and just felt like, well, that's going to be my fate too, because we've all had it. But actually it's very reassuring to know that, you know, if you get on top of your diet and your lifestyle and you know, you can turn things around and you don't have to go down the same path. So that's great. So do you have any final tip or tips? We've said basically speak to your female members of your family if you can to find out what their experience was. Don't smoke, keep a healthy weight, exercise, and anything else.
No, I think that summed it up very nicely.
Okay, well, it's been an absolute pleasure talking to you. It's
really so great to speak to you. Thank you.
Just going about this stuff all day, but yeah, it was really fascinating. Thanks for sharing your time and your experience, and look forward to seeing you again soon.
You're welcome. Bye.
Thanks. Bye.